The following segment is sponsored by Intermountain Healthcare and the Utah Department of Health.
Lead Poisoning Prevention Week begins October 22nd, and the big push this year is for children to get tested. Holly Menino explains.
So children ages 1 to 5 are at the highest risk for lead.
There's long been concern that children are under-tested for lead poisoning, and a new study shows that's especially true in the West.
Across the nation, we're only finding 64% of children who do have elevated blood lead levels. However, in the western states, we are only catching 22%.
The only way to know if your child has been exposed is by testing.
Lead testing may sound scary, but it's actually very simple.
A young child or adult's finger would be pricked, a small amount of blood would be collected in a capillary tube, and then it would be analyzed in the machine.
After just a couple of minutes, you have an answer.
Anything greater than or equal to 5 micrograms per deciliter is considered elevated.
Children should be tested at both their 1- and 2-year well child visits.
Especially if you live in a home pre-1978.
It is a federal law or mandate that kids who have Medicaid insurance get screened at age 1 and again at age 2, and our state is not doing a very good job.
Currently, only about 20% of those kids are getting screened, which is scary because lead poisoning affects a child's brain, their behavior, as well as IQ score.
The damage that can be done by lead can be permanent.
The good news is that lead poisoning is 100% preventable, and a good rule of thumb is if you live in the West, just get that test.
Holly Menino for 2 News.